Hello, I'm Andrea Klein-Thomas. You hear the term artificial intelligence just about everywhere. ISPOR is tracking its impact on healthcare. And for a closer look at what this means for the pharmaceutical industry and beyond, we are joined by Thomas Senderovitz. So, Thomas, looking beyond HEOR, what are some of the major areas where AI will likely change the pharmaceutical industry?
The major areas in which AI will change the pharmaceutical industry are absolutely all of them. From discovery research, identifying new molecules, targets, how they interact, through non-clinical development, reducing number of animals, and then into clinical development where we see AI already being deployed in clinical trial simulation, protocol design, automation, image analysis, multi-omics, and then all the way through to the payer dossier generation, in the production area and beyond. So it's actually everywhere.
What do you see as ISPOR's role in facilitating the responsible use of AI to drive rigorous health, economic, and outcomes research?
ISPOR plays a central role in deploying and helping to deploy and engage its members in a trustworthy, responsible way of working with AI. It's probably fairly new to many of ISPOR members, and probably not everyone realizes how much this can impact. So discussing and engaging in good frameworks for trustworthy AI and learning from each other will be a key effort and a key responsibility for ISPOR.
Just an additional question, what excites you as we look ahead?
You know, as you can see, I'm really easily excited when it comes to AI. I'm excited about all the opportunities that this technology, it's a very broad term, will mean to not just ISPOR and the pharma, but society at large. I'm also excited by that it's not an easy area to work on. There are ethical, data ethics to think about, ethical considerations, discussions in society, but without AI, we simply can't solve the big problems, the big challenges of healthcare today.
And what questions should we be asking to make this responsible?
We should be asking ourselves, which kind of AI do we want? How do we want it deployed? How do we react to the fact that some jobs will be changed? We will no longer, as human beings, be involved in a lot of the routine work. We will work on it in different ways. How do we react to serendipity findings when very advanced algorithms identify new risk factors and so forth? These are some of the questions we have to ask ourselves.
We continue the conversation with Hua Zhu.
I think it's going to change every field, every industry, starting with improving efficiency.
Xu says one of those fields will be natural language processing, or NLP.
NLP has been significantly changed by the new technology of generative AI, particularly the large language models, actually. So in the past, when we do NLP, we actually have to develop individual models for different tasks. For example, I have one model for question answering, one model for machine translation. But now, the beauty of a large language model is actually it performs well on all those different tasks. So what it leads to is basically you can quickly build application on the top of a single robust large language model, which really actually leads to a shift of NLP methods, system development more towards large language model now.
Cheyenne Wong agrees that AI will increase efficiency.
I'm a firm believer that large language models and the current generative AI will transform the way we're doing life science, particularly all the data existing in the healthcare domain will be translated in a way can be used in life sciences and make the drug discovery, drug development a lot faster and efficient.
Why is prompt engineering a useful tool for HEOR scientists?
Prompt engineering is a very useful tool for HEOR professionals. Computer coding has been a very complicated task in the past for even computer scientists or engineers. But with large language models, with generative AI technologies, so prompt engineering is really using natural queries, just like you're talking to your parents, you're just asking what is your day looks like. So it is a natural way of asking things. The model take whatever you ask and then translate into coding and then give you the response already. So everything is in a natural query input and a natural output as well.
What are some examples of how you are currently using generative AI?
I have been using generative AI in a lot of areas. So the first one I've been working a lot in the past year and a half is using large language models and generative AI in clinical trials. So we actually published a paper called Auto Criteria. What it does is to extract all those inclusion exclusion criteria from protocols and get them structured, becoming computable, and then query them. So now if you want to see how people really design and utilize which criteria in their protocols for last 20 years, with one click you get all the distributions, how it's designed in the past 20 years from different competitors or from your peers. So that's one area. The second one is a clinical real-world evidence studies. So we actually built a lot of tools on patient journey using large language models, getting information from comprehensive electronic record data, structured and unstructured, and build them into a journey for patients, not only for one patient, but also for a cohort of patients for a population. The third way we use it is from social media. Lots of people express their opinions through platforms like Twitter or YouTube, and we actually really hear that using language models and get the patient experience from it.
Thanks for joining us. I'm Andrea Klein-Thomas. For more information about key topics in healthcare, go to ISPOR.org.